Hello, let's learn about diagnostic stewardship in viral infections. Virus infections and fungal infections. Viruses are intracellular. They require host machinery to replicate, while bacteria can survive on their own. Fungi can survive on their own. Viral infections are usually asymptomatic and overlapping signs and symptoms, and difficult to diagnose clinically, while bacterial infections have typical signs and symptoms as well as fungal infections. Apart from viral infection, stimulus lots of three host inflammatory responses, and they have indirect effects. While bacterial infection symptoms are due to direct effects. Also, fungal infections are due to direct effects. While viral infection, there are indirect effects, and there is a lot of host inflammatory responses. Lab diagnosis are very difficult in viral infections to investigate. One is serology and other is molecular test. While bacterial infection, we have easy to diagnose tests like culture sensitivity. Even for the fungal, we have easy to diagnose tests like culture sensitivity as well as histopathology and staining. Let us see this case how to establish a viral etiology. A 55-year-old male with chronic liver disease reaches emergency with features of acute decomposition of cirrhosis with development of ascites, hepatic encephalopathy. Complete workup was done for sudden liver insult. No bacterial or hepatitis viruses was found. Due to encephalopathy, the plasma was sent to virology for viral panel. Plasma was positive for HSV1 DNA on PCR. Patient started on assay clever, condition improved and decomposition started. Adequate decomposition causes not always bacterial. Let's see the second case. A previously well and immunocompetent woman presented with fever of unknown origin and acute hepatitis. Her clinical examination was unremarkable with no clear focus of infection. Viral hepatitis ATE was negative and autoimmune markers were negative. Samples were tested for non-hepatotrophic viral infections and CM with IgG, IgM, and cytomegalovirus DNA were positive. Symptoms resolved with supportive care and no antiviral therapy was needed. This case highlights acute hepatitis in a well immunocompetent patient can be due to cytomegalovirus 2. There is a need to establish a viral etiology. Correct diagnosis, and appropriate and timely management of patients is required. To start antivirals for HIV, HBV, HCV, CMV, and influenza. De-escalation of antibiotics should be considered. Meningitis or encephalitis or in such cases HSV diagnosis is essential. Public health importance is required to define epidemics for surveillance of viral infections. What is viral diagnostic stewardship? You need to select the right viral test with right sample collection, generating accurate clinical relevant tests at the right time to optimally influence clinical care and to conserve unnecessary use of antibiotics. The diagnostic methods in virology include virus detection, direct or indirect methods. The direct methods include culture and microscopy. Indirect methods include serology and molecular tests. The timing of infection or one set of symptoms is very important. Regarding viral culture tests, the options available are cell lines or tissue cultures, egg inoculation, or animal culture. However, they have limited use in written diagnosis. Technically, they are challenging. The longer duration is an issue, and they are lesser sensitive. It's done for virus propagation, antigen preparation, vaccine preparation to study antiviral effects. Timing of viral culture tests should be during the early phase of infection before antibody formation. Samples should be representative of the site of viral infection. Viral microscopy done by electron microscopy, where we see the viral ultrastructure, or light microscopy, where we see the direct staining for inclusion bodies. And it has, however, limited use in diagnostic virology because of its lesser sensitivity. Other indirect assays available are antigen assays, which should be done in initial phase of infection, that is during 1 to 7 days. Antibody assays, that is IgM, initial phases after 50 days to 1 month. IgG is done in later phase, that is more than 2 to 3 weeks. Acute infections are marker of exposure or serochronism. It has a diagnostic role in chronic infection like HCV or HIV. Molecular assays like NAT, PCR, or real-time PCR are examples for other indirect assays. What are the methods to do viral serology testings? Rapid card test or POCT, ELISA, chemiluminescence, immunofluorescence assays, and others are hemagglutinin, CFT, Western blot assay. So it depends upon the type of infection we have syndromic or duration based classification. What is the right choice of a viral test? What is the need for a viral test? Screening, diagnosis, or monitoring are the indication for viral test. To identify the type of viral infections. Syndromic approach is better. Duration of illness can be acute or chronic. Identify the site of viral infection. Accordingly, the sample collection should be done. Choose the right test. It depends upon the host risk factors, exposure, country occurrence. For example, LA fever not in India, or Japanese is present in East or South India. So accordingly, the viral test should be. Antigen test is done during the first week, however, it is lesser sensitive but specific. PCR is done from the first week up to fourth week. It is very sensitive. IgM has a limited role in acute diagnosis. IgG is indicated for past exposure. So here is an example of a COVID-19 acute viral infection test is where according to based on the duration, that particular test is advised. Similarly, for dengue viral infections, dengue PCR is indicated for the first 1 to 5 days of onset of fever. NS1 antigen is indicated in 1 to 9 days of onset of fever. The IgM test post 5 days of symptoms, and IgG has no significance in acute diagnosis. That's all. We'll see in details about diagnostics in viral infection in my next session. Thank you.